Hi, everyone. Thank you for joining us. Okay. We'll let folks pile into the room and then we'll get started about 2 minutes after. Just a heads up, we're recording this so that we can share it after the fact with everyone. And we'll get started soon. Okay, we'll give folks one more minute to join. And I'll just call your attention to the chat. Please do use that for any feedback for us, any questions throughout. Introduce yourself, all the above. Okay, I think we can get started. Just give it one more second. Okay, great. Hi, everyone. I'm Rebecca Gilio. I'm our Deputy Director for the Common Health Coalition. Thank you for joining us. Happy New Year. We're very excited to be announcing our 2026 challenge and really diving into the details of what we mean when we say regional action networks and what we're trying to accomplish. This go around, we'll give you a quick reminder who's the Common Health Coalition. If you're meeting us for the first time, this is a good opportunity for us to share who we are, what are we here to do. We'll talk a bit about the annual challenge. This is our second annual challenge, and we'll tell you a bit what we like to accomplish with that each year. And then we'll dive into the details of the Catalyst Award opportunity. So with that, let me introduce you to Chelsea Cipriano, our Managing Director, to tell you a bit more.
Thank you so much, Rebecca. Thanks everyone for being here. We're so grateful for you taking the time. I'm sure we know many of you, but for those who don't, we are the Common Health Coalition. I'm Chelsea Cipriano. I'm the Managing Director of the coalition. The coalition was created just over 2 years ago, and we're still pretty young. So thanks for those who have been with us since the beginning. But we were really created to bring together organizations across the health spectrum in pursuit of this reimagined health system where we work together across healthcare and public health and not in the traditional silos that we have worked in for so long. And we saw a lot of this during the pandemic, during the COVID-19 pandemic, but also through other exacerbations of issues where when the two sectors really come together, we do better. We do better for the people that we're all aiming to serve, which is our patients and our communities. So that's the whole ethos of the coalition. Rebecca will talk about joining later. It's free to join. And we're just so grateful for everyone who's joined this really massive tent with us. We're at now nearly 350 organizations in 45 states. So it's been quick growth, but that just means that a lot of people are really bought into this concept that we can do better if we do it together. This is the coalition's care model. Oh, sorry. We don't have to go back. That's okay. The care model there on the slides, which is also on our website, is really just our focus areas so that we're not trying to boil the ocean because really this charge could be so many things, but we try to focus on these four core areas of work, of which I'm sure many of you are focused on as well. So that's our care model. Very quickly, coalition highlights. These are probably too small for you to read on the screen, or maybe your eyesight is better than mine and you're younger than I am. but you can scan the QR codes here just to see what the coalition has really been up to, what we do. We think of ourselves as a megaphone, a matchmaker, and a mobilizer for our members and organizations. I'm seeing in the chat that some folks can't see the slides, so I'm not sure if that's only a couple folks, but if you aren't seeing this, they will be shared afterwards. Great. So check us out if you haven't seen our materials. We've got a lot of great resources online, including our recent work in the vaccine arena, trying to really be a neutral convener on vaccines that offers taking folks from confidence to clarity, or sorry, from confusion to clarity to confidence amidst this very confusing time on national vaccine landscape. Next slide. Okay, so we got here. One of the things that the coalition does in our mobilizer roles that we're really proud of and to be able to offer is the annual Common Health Challenge. Last year was our first challenge, was the inaugural challenge, and we'll talk a bit more about what that was about, how it went. Maybe many of you who are on were participants in that challenge, but essentially it's a call to action. So across our 350 and growing members, we want to rally around a critical issue that really necessitates, or the solution lives in these cross-sector partnerships of doing better together. And so there are three ways to get involved in the Common Health Challenge each year. One, taking the challenge. That's the lowest lift. That's like raising your hand as an organization, not individuals, but organization, and saying, I'm here for this. I support this. I'm working on this in my organization. I agree with this challenge mission, and I want to try to bake it into what we're doing this year. And sure, feel free to highlight my work. Here are some links. We would love the amplification. That's basically the gist on taking the challenge. Super low lift, as I said, very, very no commitment other than working towards this goal. Two, the community of practice. This is like a little higher for we're working up the steps here. So next level, community of practice, we convene a group of orgs who are engaged in this work, are interested in learning more, and they share with each other, and they share best practices, they share things that aren't going so well, funding challenges. I'll let Lauren from IPHI speak more about this later. IPHIs are, when Nick is on as well, are wonderful facilitators of that community of practice, and just really having a space for folks to share and learn from each other. And then three, the Catalyst Awards. So that's like the highest lift level, where we actually award funding to vanguard communities and organizations that are engaged in this work, and really can serve as an entity that we can learn from and help expand, and then hopefully replicate the work across the country because of what you're doing on the ground today. So that's the challenge, the gist of the challenge. Next slide. This was our 2025 challenge. As I said, we focused on community health workers serving as this bridge between healthcare and public health. We had, many over 200 organizations raise their hands and say yes to the challenge. See Ramana in the chat. Thank you so much for your participation and expertise in this space. More than 60 participated in our community of practice, so really stayed engaged and learned from each other, and helped us learn from you. And then 11 organizations were awarded really smaller grants of about $40,000 each to advance what they were doing on the ground. And out of that, we had excellent lessons learned. We came up with this partnership engagement spectrum that really shows how you can go from working with and being aware of community health community health workers and CHWs to truly sustained impact and partnership, because that's what we're getting at. We're getting at impact. We're not here to just like put out, papers and assessments. We want to highlight your work. We want to drive impact. We want to drive action, and we want to better serve people. So that's what we're all about, and we hope you are too. Next slide. This year's challenge, so very exciting, as you have probably saw because you're here. This year, we are focused on what we're calling regional action networks. So essentially, work that probably a lot of you are already engaged in, but we want to put a spotlight on, we want to replicate, we want to make more sustainable across the country. So cross-border, meaning intrastate or interstate, work that's happening between healthcare and public health. That is one essential component. So it needs to be really a true partnership between healthcare and public health organizations, where we're building these sustainable systems that can respond to challenges, changing health landscapes, and whatnot, but really ultimately drive better health for both patients and communities. These are the four components to make it a bit more concrete, and then I'll pass to Lauren to dive in deeper. Four components of what we're imagining strong RANs to have, and yours do not need to have all of these. This is what we'll be helping provide tools, resources, learnings to drive. Backbone organization. So truly a neutral backbone organization for shared commitments and priority setting so that there's some kind of organization serving as that. Two, what we'd really like to see more of, particularly in this funding environment, in this fiscal chaos that we are all in, is the ability to build partnerships and shared investments across healthcare and public health, so that we aren't trying to philanthropy our way out of this because we can't, but we can work together and share resources, including funding. Three, data. So how are we sharing data across regions? Currently, this is happening in a lot of places, and we can't wait to learn more and amplify that great success that many of you have seen. But how can we do it in other places as well? And then community. So both community engagement and bidirectional communications from the community so that what you're doing at the grass tops is being responsive to the grassroots, responsive to and informed by. Okay, I think I will stop there. That's my overview of this year's challenge. We are so excited about this. This feels really timely, that we're focused on this area across all of our members. We know so many of you are already doing this work, and I'm just excited to be able to learn more about what you're doing and put a spotlight on it because this is the stuff that doesn't always get the spotlight, and it should. And so we're here to help support you and sing your praises and help other people do what you're doing. Great. Lauren, I'm passing to you. Thanks, y'all.
Thank you so much, Chelsea. So as Chelsea said, one of the ways that you can get involved with this year's challenge is by simply taking the challenge and sharing that great work that you're already doing that aligns with these areas. So in the coming weeks on the Coalition website, we'll have some suggested activities that you can engage with. And we also welcome your ideas. You can tell us how you are engaging with RANs, how you're supporting this work to really build and advance this movement nationwide. So we're going to dive next into some of those other ways that you can really get involved with this year's challenge. First, I'm going to talk about the community of practice at a high level. Catalyst awardees and eligible coalition members are invited to join a community of practice to facilitate this shared learning and enhance these effective RAN models. So like Chelsea said, it's all about learning and growing and advancing these models for sustainability. So this is one of those spaces where we're able to do that and learn from each other and learn from you all. COP participants attend quarterly virtual meetings for this peer-to-peer learning and collaboration. In between sessions, they also have access to an exclusive platform where they can participate in community forum discussions, connect with other COP members directly doing similar work to really build those true partnerships, and utilize a curated resource directory relevant to the aims of the theme and the awardees projects. All of the COP sessions are recorded and shared on the platform, so you can go back to them and continue to learn from those discussions. Catalyst awardees are required to participate in the community of practice. Trust me, it's to their benefit. But other interested coalition members can also reach out to us to express their interest in joining, and we can help get you set up to participate in that community of practice. 2025 community health worker COP members have found these sessions to be so useful that we've actually extended that community of practice and have added additional monthly sessions as they continue their projects. So we're really, really looking forward to this RAN community of practice. And if you do have the capacity to engage with the challenge at this level, I hope to see you there. The 2026 Catalyst Awards are the highest level of engagement, as Chelsea mentioned. These are really leaders in the space that are going to be sharing their work and having a required set of deliverables in collaboration with the coalition and other RAN cohort members to really amplify these models and help with sustainability and replication all over the country. So the 2026 Catalyst Awards will invest at least $500,000 in the creation and growth of regional action networks. Awardees will implement activities to start, expand, or scale a regional network by advancing one or more of those key pillars of RAN sustainability that Chelsea went over earlier: backbone, funds, data, and community. Applicants with at least one of the 4 key pillars in place can apply. So for example, if you have a backbone organization, but you're really working to identify an equity strategy or ways to share data across the region, those would be your proposed activities in your application that the coalition can help support to take that RAN to the next level. Similarly, we've seen regional action networks that have been born out of existing regional data sharing infrastructure. There might be some platform out there or some group that's doing work with data, but maybe it's not being utilized for a certain issue or to advance action on a certain inequity. Your RAN could do that and really leverage that regional infrastructure to, again, create, expand, scale that RAN and achieve these goals. So proposed projects should be able to demonstrate significant progress on those goals during the 1-year award period. Specific to the identified health needs of their region, the work done to advance these pillars is really going to support the establishment of sustainable networks. These RANs are capable of always-on coordination to maintain strong partnerships, reduce inequities, and improve outcomes for patients and communities across their region. So some of the ways that you can do that are up here on the screen. These are examples of activities that an applicant may propose. They might have ambitions to scale their network, either geographically or in terms of the partners that they're engaging across sectors. An applicant may want to focus on developing those data sharing agreements or that regional data sharing infrastructure. They may even want to engage community health worker programs to collect local data and drive the shaping of shared equity goals. This list is not exhaustive, and we really believe it's possible for awardees to implement multiple activities with the resources provided through the Catalyst Award funds. So as you're thinking about your application and how you may be able to advance one or more of those pillars for your RAN, we also welcome your ideas that align with the purpose of the challenge. 3 to 5 RAN will be selected to receive a Catalyst Award. So as you're thinking about becoming one of those awardees, we're going to really dive into those details of how you can apply and what you should expect as an awardee. After this meeting today, we'll add all of the information that you need to the coalition website to complete your application. So step 1 to becoming a Catalyst awardee is to check your eligibility. On the next slide, we'll actually preview the 6 questions included in the eligibility check. But this is a super simple form online, 6 yes or no questions that you'll need to complete in order to apply. You'll be able to download a copy of the responses to your self-check eligibility assessment, and that should be included with your submitted application. If you're not quite sure, you have some questions, or you really just want to talk to somebody about your project, you can always reach us by email info@commonhealthcoalition.org is a space that's monitored by multiple staff members, so you get really fast responses. And then we'll also be hosting office hours starting this Friday and lasting through January, where you can just drop in any Wednesday or Friday, 4 to 4:30 p.m. Eastern Time, and ask those questions. So we'll be here to provide that application support and make sure that everyone who's eligible gets that chance to apply.
Thanks, Lauren. I'll just quickly add there, if as you're going through the assessment, if you see questions or components where you're like, I think we could get there, we're not there yet. We want to hear from you now and want to have that conversation with you now. That's a huge reason why we're doing the office hours. We're particularly interested in regions where this might be really, really difficult to set up. And if that's you, definitely get in touch with us now, set up time, and we can talk about where you are at that stage of readiness to really get these things going. We know, like Chelsea said, these exist. This is a model that exists, and folks are at all sorts of stages with this work right now. So again, wherever you are on that spectrum, we really want to hear from you.
And can I just hop in really quick, Rebecca and Lauren? I think one of the biggest questions that we've gotten so far about kind of what we're looking for here is about, does this need to be only about vaccine or emergency response or something like that from the regional perspective? And the answer is no. We know that there are organizations out there, new and long-standing, that have been set up around crisis response. There are also organizations that have been set up to do very concerted data sharing and work on hypertension, right? Like we are intentionally taking a disease or focus agnostic approach here because we know that there is no one size fits all model per se, but there are great examples of this model in action across all of those different pathogens and policy challenges. So regardless of the challenge that you are taking on together, we're interested in knowing what you're doing and uplifting that because other people are facing those challenges, particularly right now. So just wanted to clarify that.
Yeah, thank you both so much for that clarification. And just reiterating that if you're not quite sure, the best thing to do is just reach out and have that conversation. You're going to reach me, you're going to reach Rebecca, you're going to reach Chelsea, and we're going to be able to sit down and talk through that with you. So as we look at the eligibility questions, these again are going to be yes, no in the self-check eligibility assessment form. They're summarized here. So there is a little bit more detail in the form that just kind of helps guide you through the questions and gives you some responses. But generally, we're looking to confirm that the lead applicant is located in the United States or one of its territories, that the activities being delivered by the RAN are also being delivered in the United States or that U.S. territory. The lead applicant organization must be an eligible organization type. There's a very specific list that is on the website, in the form, on all the documents, but in general, you can't be a federal government entity. We're really trying to build off of the work being done at that level and look at that regional, state, local level. So that's really the biggest sort of X on that eligibility for type. But there's specific eligible organization types that you can look at and make sure that your lead applicant organization meets that criteria. You only need to have one or more of those 4 pillars in place as a RAN to be eligible. So as Rebecca stated, you don't have to be at that highest level of a network in order to apply. You can have a strong foundation and a strong plan to really advance that. And that's what we're hoping to see with those applications. The activities must be implemented cross-border. So as Chelsea noted, that's intra or interstate, crossing county or state border lines. And the lead applicant organization must be a CHC member. We'll talk more about what membership means. It's free, and really engaging in the challenge in any of these ways makes you eligible for membership. So as you're thinking about your eligibility and perhaps even your application proposal, here's what to expect with the application timeline. This week, following the informational webinar, the website will be updated to include the 2026 Catalyst Awards request for applications. That document includes far more detail than what we're covering today. So that's really your main source of information for application. And then we'll also have a running FAQ driven by the questions that you all ask today and submit to us during the application period. And of course, we'll be available to provide support during that period as well. Applications for Catalyst Awards are due February 2nd, no later than 11:59 p.m. Pacific time. We want to be mindful of our West Coast applicants. I know sometimes you get an East Coast funder and they have these really tight deadlines that are in the middle of your day. So that application deadline is West Coast time to give you the full length of that day to submit, February 2nd. Throughout February is when we will do the review. So a panel of reviewers will look at applicants and score those applications. And I'll provide more information about what that will look like a little later on in this discussion. By early March, we'll make notifications to applicants and announce the awardees. In late March, we'll also host an orientation for the community of practice and for the Catalyst awardees. So if you're really interested in that community of practice, that March date in late March is when you'll want to join us for that orientation. And April is when the projects for the Catalyst Awards will begin. So from that April start date, we can roll right into that implementation period, which will last April 1st, 2026 through March 31st, 2027. During this 12-month period, the coalition will offer technical assistance. Technical assistance needs will be determined collaboratively with the awardees, and the awardees will participate in the community of practice. I'll give a few examples of what that technical assistance might look like when we talk about what awardees can expect. Applications will be submitted via email, just reiterating that deadline of February 2nd. Your complete application will include general information about the lead applicant organization and the RAN, narrative responses to 5 open-ended questions, a brief budget narrative, and several attachments. You can see those on screen here. Some are required. The response copy of your self-check eligibility assessment, your budget, an organization chart of the RAN, an activities timeline for your proposed project, and an evaluation chart, again, specific to your proposed project activities. These documents are really going to benefit you when it comes to maximizing your application space and making sure that reviewers have all of the information they need to comprehend and process the impact of your proposal. Really specific details and guidance are included in the request for applications document, and I'll be available if you have any questions while you're working on your application. So when we think about the application narrative specifically, these are the 5 open-ended questions that you'll be responding to and submitting with your application product. The first thing that we want to get an idea for is the Regional Action Network itself. We'll ask you to tell us more about the RAN's area of service, its focus area or areas, and its history. When we think about area of service, this is referring to the geographic areas included in the Regional Action Network. Those are those intra or interstate connections and those borders that you're crossing and reaching through that network collaborative. Focus areas refer to a specific gap in healthcare and public health delivery that's being addressed by the RAN. We've seen some regional action networks focus on one specific critical issue, and others that may focus on a group of issues or a larger mission that includes multiple activities. And RAN history really just generally refers to information about the creation of the RAN and any key activities it's conducted to date to advance its work. So if it's a RAN that's just starting out, there may not be as much detail to provide here, but you can definitely tell us the foundation for that RAN, which of the key pillars you are meeting, and then we'll be really interested to see how you plan to advance those. For the open-ended response 2, we'll really be asking you to tell us more about the RAN's capacity to implement the activities proposed in your application. This is where you'll identify key personnel of the RAN and describe their role and experience. You can include details on existing efforts or future plans specific to the 4 pillars of an effective RAN. Again, that backbone, investments, data, and community. This question will also be supplemented by the RAN organizational chart and the activities timeline. So again, include as much information across all of those required documents to really give the reviewers a good sense of how the RAN would implement these activities and who is going to be responsible for doing that within the network. This is where you can really leverage the individual strength of those network partners. Third, we want to know how the RAN advances or plans to advance health equity. This can also be supplemented in the activities timeline and the SMART evaluation chart. We'll ask you to describe how the RAN will actively scale in terms of geography or their partnerships. And finally, you'll describe the potential impact of the Regional Action Network on strengthening collaborations that address these critical system gaps. Remember that these are all specific to your Catalyst Award RAN proposal. So when we think about activities, those are centered in advancing one or more of the 4 pillars. When we think about evaluation, you're evaluating the activities of the proposal, not necessarily a full-scale RAN evaluation plan. That might even be something you develop as one of your proposed activities. So another key element of your submission is going to be the budget. A budget template will be provided and will be available with the request for applications document online. This should be submitted with your application and should really align with the brief budget narrative and align with your activities and personnel identified. Funds cannot be used for capital investments, physical equipment purchases exceeding $5,000, direct client medical services like purchasing medications, covering treatment costs, or purchasing medical equipment, or lobbying activities. Otherwise, your budget should support the RAN resources required to implement your proposed activities to advance one or more of your pillars. The expenses identified in your budget, again, should make sense in the context of the key personnel you've described and the activities timeline for your proposed project. Each application, once it's submitted, will be reviewed and scored by a panel of reviewers. They'll each score your proposal based on a very specific rubric, and they'll have guidance on how to interpret and consider your application, which we'll go into more detail about next. But in general, we're looking at these 6 different areas, and this is where you'll receive your scores: RAN readiness, past performance, commitment to equity, partner resource utilization plan, budget narrative, and impact. So when we think about past performance, this doesn't necessarily have to be, again, past performance as a brand that's already developed and active. We're looking for past performance of the lead applicant organization that really shows their experience in community health, public health collaboration, or related initiatives. So think about those strengths of the RAN members and who's in that network. That's what we want to hear about. When we think about RAN readiness, this is specifically the effectiveness and the ability of the RAN to implement those cross-border initiatives that will strengthen collaborations between healthcare and public health. Those are those strengthened collaborations that we're really looking for, is between those public health and healthcare systems. When we think about commitment to equity, we'll look at shared goals that reduce inequities in access, care, and/or health outcomes. These may be already in place or a proposed activity of the RAN that haven't quite been developed yet. We can also see commitment to equity again in the lead applicant organizations and in RAN members' activities outside of or in addition to the RAN as they've developed that. We'll talk a little bit more about the partner resource utilization plan on the next slide, but really this is how you're describing how the RAN will strengthen partnerships for those cross-border initiatives. And then the impact really looks at how will the RAN be equipped when all of this is over to be a sustainable force, a sustainable network that can respond to these emerging health issues in ways which improve outcomes for patients and communities. So when we think about the impact of the Catalyst Award and the impact of the activities, we want to know, what is that impact going to be on the RAN's advancement and on their sustainability to advance these 4 pillars and be able to address these needs in their region. The highest scoring applicants will be considered for an award. The coalition may also consider the RAN's geographic scope, the lead applicant organization type, and critical systems gaps addressed in addition to the criteria above. So I see a couple related questions in the chat that I'm just going to take a moment to address now because I think they're relevant to the topics that we've just covered. Connie asked if we have more specific or detailed definitions of the 4 RAN pillars. There is a little bit of additional detail in the request for applications. There are examples. The activities suggested also tie back to those pillars. If you're unsure if, as an applicant, you're meeting the eligibility or the requirement for one pillar to be in place, reach out to us. We can really just take a quick look at your organization, hear about your work, and help with that guidance as to whether you would be a qualified applicant. So you are right, Connie, they are a broad spectrum, but to an extent, they're meant to be that way so that we can accommodate the different level of RAN capacity that currently exists. We want to see those that are still being developed, but have that strong foundation, as well as those that are more developed and are really looking to sustain and formalize some of those activities.
Yeah, thanks for that, Lauren. I think it's good that we elevated that question now. Yeah, exactly what Lauren said. We don't want to be overly prescriptive and just want to reinforce we're not expecting applicants to have all 4 of these in place. So if you can tell us how you have one in place and your plans to put others in place, that's really what we're looking for. So there's room for you to describe for us how you think you're meeting those pillars.
Thanks so much, Rebecca. And then also to address a question from Rumana, she said that the implementation of the tool or intervention, should that be ready to go since it is a 1-year time frame? This is really unique funding. So I do just want to clarify that we are really looking to fund those strategic relationships and the work that it takes behind the scenes to advance collaborations. A lot of funding is really looking to specifically fund direct programs and direct services. That's not really what this funding is for. This is for those behind the scenes activities that you don't often get support for. And so that's where the activities stop a lot of times because people don't have the resources they need in order to make those plans, in order to have those conversations about strategy in order to develop new relationships and come up with these shared goals. So that's really what the funding is for. So no, you don't have to have a tool that's like ready to go in place. We would hope that your proposal in advancing one of the pillars may result in a tool or a platform that the RAN is using to support that sustainability moving forward. Okay. I'll continue to come back to questions, so please add those in the chat. We'll also have a last call for questions at the end of the session, and we will include questions that are being asked and answered in the FAQ as well. So you'll be able to go back and see all of the questions and answers that we've covered today in that FAQ document as well. So diving a little bit deeper into the review considerations, these are all in the request for applications document. So we're really, really detailed about what we're looking for, how we're scoring things, and how we're considering these applications. We want you to use this information to your benefit and for it to not be a mystery why someone is receiving a score that they're receiving or why we interpreted an application in a certain way. So reviewers will consider your open-ended responses, your RAN organization chart, your activities timeline, and your SMART evaluation chart and budget. Letters of support aren't required, but you can submit up to 5 of those, and those would also be considered by reviewers if included. So you can see on the screen some of the guidance for reviewers. These all tie back to those different areas of scoring: past performance, RAN readiness, commitment to equity, partner resource utilization plan, budget narrative, and impact. But these are just diving a little bit deeper. So as you're creating your application, as you're completing your responses to your open-ended questions and working on your activities timeline and your budget, this is where you should be coming back to and really going through and asking yourself these questions and deciding, does my application answer this question? Are reviewers really going to be able to get a sense of what's going on across all of the information and content that we've submitted? So one thing I do want to call out is the partner resource utilization plan, because this is not a really specific document. It's not like the organization chart or the activities timeline that you're going to be submitting. It's not an actual plan. It's really just an overall assessment of the RAN's capacity and the application's description of how the network will be leveraged to advance those pillars. So when we think about the partner resource utilization plan, what reviewers will be asking themselves is, across the application documents, have the applicants clearly describe the partnerships that will be formed or enhanced? Are there specific activities identified that are relevant and feasible for the applicant to implement? And does the plan include community health worker integration in its described partnerships and activities, if applicable? So again, that is not a specific plan or document that you're submitting. It's a concept that reviewers are assessing across your application content. So awardee requirements. This is what Catalyst awardees can expect if they are approved for funding. We'll get a contract agreement in place and distribute award funds to them. We'll host that virtual awardee orientation in late March. Awardees will utilize the award funds to implement the activities in their approved application during that 12-month implementation period. They'll collaborate with the coalition to determine any technical assistance needs and participate in meetings to deliver that technical assistance as needed. They'll participate in a quarterly community of practice. We'll have bi-monthly, which are every other month, check-ins via email. There will be a video recording that you'll participate in preparation for the coalition's annual meeting in the fall. And we'll ask you to contribute to challenge initiatives on a quarterly basis and share lessons learned. So those are not necessarily low lifts, but ways that we are going to be amplifying the work being done by the awardees and really providing those opportunities for the larger coalition network to learn from what's being done and amplify and replicate those impacts. So we'll actually work with you throughout the award period to identify what those contributions look like. It might be a highlight in a newsletter. It might be a quote in a media interview. It might be presenting at a webinar. There's a lot of different ways that you can contribute to challenge products. And then sharing lessons learned and successes. We'll also have multiple opportunities for folks to do that, and we'll coordinate and collaborate on what that looks like with awardees. So this is a sample awardee timeline. Again, if you are one of the approved Catalyst awardees, these are the periods of activity that you can expect, and those little tick marks that you see are where there would be a specific deliverable related to that particular activity. So it's not too much as far as requirements for deliverables outside of your proposed project activities. We're really here to support the success of your application in advancing those pillars, and that's through the technical assistance, through the check-ins, and through the community of practice. But we'll definitely work with you and make sure that we're making it as easy as possible to contribute to other products, participate in the challenge in other ways, and meet those deliverables. Quick snapshot of what technical assistance can look like. These are just some of the topics that we've sort of pre-identified that we feel will be most relevant to the RANs and their goals in advancing those 4 pillars. We will work collaboratively with the awardees to really determine what the needs are around technical assistance and what that looks like. But one thing that I do want to call out is that for us, technical assistance is not only discussion. It's not only having a conversation and maybe providing some suggestions. We can do things that are more hands-on as well. We can help you to create templates. We can help to facilitate a partner conversation as a neutral convener. We can review a RAND document or process that you're considering or developing and give feedback on that more intentionally. So we're always available for discussion. We'll always bring in any partners, experts, other awardees needed to help make sure that that conversation is as productive as possible. But these, again, are just some examples of what that technical assistance might look like. When we think about evaluation and reporting, it's a pretty low lift. Again, we're really focusing the funding on those partnerships, on strengthening the partnerships between public health and healthcare in ways that will advance those 4 pillars. So for our interest, when we do our bi-monthly check-ins, you can see those check-ins consist of 3 questions on the right-hand side of your screen there. This is a great opportunity throughout the project period for awardees to share and identify their technical assistance needs, to share wins that we can highlight, stories and successes, and also to identify challenges that we can then address in the community of practice or make intentional connections for to help you overcome those barriers. I mentioned the highlight reel participation for the annual meeting. That's a really simple virtual video recording that we'll do. It's actually really fun, so I look forward to that with those that are selected as awardees. And then a simple final report will be expected at the end of the project period. A template will be provided for that. And it's really, again, looking at the impact of the award. So how have those funds helped the RAN expand reach, strengthen partnerships, access more sustainable funding, and how has it changed partner perspectives to more confident, more positive assessments of the RAN's capacity and activities? So I'm going to briefly turn it back over to Rebecca and Chelsea just to go back to the coalition membership, sort of the overarching entry point into all of this amazing content, all of these amazing resources and the challenge. And then we'll actually wrap up and get you guys out of here for the day. So Rebecca?
Yeah, thanks, Lauren. And I'll just quickly address, because I know there were some questions in the chat from both Leah and Carrie about our priorities. And I think this was to the comment I made about regions where this might be something that's hard to set up. So I just wanted to clarify quickly. We just want to make sure we are thinking about geographic diversity and that we're not only thinking about the regional networks that they're well established. They've already had press releases out. They've already been well covered. So I think what I would say is we would really invite you all when you're applying, particularly if you're in earlier stages or you have not yet publicly announced what you're doing, to let us know what do you see as the barriers that your region has experienced this historically in the current moment to setting up something like this. And that's why we would also really invite you to join us for office hours so we can hear that from you too and see if there's anything that really would
Hmm.
count towards what we're thinking about as the pillars. But basically, we want to take that into account, just as we did with the 2025 challenge, and make sure we're hearing from the whole country.
And I'll just add to that. Thanks, Rebecca. I think that covers it great. In one of our resources around vaccine, we have a map. Maybe some of you have seen it, but really that shows states that have taken action around um, access and whether it's legislative or executive action and things like that. And one of the pieces of feedback that we got from a number of states was, "Hey, we're doing things just because we may not be out there with a press release about it, or we're not able to take an executive or governor level action or legislative action, doesn't mean we're not doing it." And so we want to acknowledge that. I live in Louisiana part time, and I think the states, particularly those in rural areas in the South, have a lot of great work happening, but are in a different position to talk about it differently or perhaps promote it differently. And we just want to acknowledge that we know good work is happening in states across the country that we may not be seeing and hearing about, and we want to know about it. So, honestly, Catalyst Awards aside, like this is where we really want to get some of that intel about what's happening and how we can help others do it as well. So, thanks for that question.
Yeah, that was a great question. Thanks so much, Chelsea. Fantastic. Yeah, like I said, come meet with us too, so that we can hear more from you. Okay, and then I will also just say before I get to membership, Lauren and the IPHI team has really been fantastic in facilitating our challenge activities, particularly with the 2025 challenge. I know I heard from a lot of folks that their technical assistance was super helpful. So I just want to say you would be well supported, and that we're really here to pull in other experts and make sure everyone's getting the resources that they need through the COP and also as part of the Catalyst Word program. So thank you so much to Lauren and team. Okay, and then just to close us out, so you heard us say we're a membership organization. We're getting close to 350 members across all sectors in health, payer organizations, healthcare, public health, academic institutions. So if you're not already a member, uh, and just participating in this webinar, you're probably doing at least one of the activities that we've mentioned. Also, that's why we brought up taking the challenge. That's why we brought up joining the COP. Any of these activities would mean you are very eligible for the coalition. So we'll just put the join link in the chat. We're happy to sign you up when you participate in these other activities. We can make it really easy for you. And what we hear from our members that they find helpful is we have a ton of resources for members that really synthesize the news, what's going on in the news, resources and information. We make connections on your behalf. We do what Chelsea said, the mobilizing megaphone. We do all of that. And at the end of the day, we're really intending to be a collective movement around bringing healthcare and public health closer together. So if that sounds like something you're interested in, write me a note, put something in our join form, and we will get back to you about joining the coalition. I think that's it for me. Maybe we just spend another minute seeing if there's any other questions. Please feel free to write them in the chat. And then we're happy to, yes, organizations can sign up at any point. There isn't just one time where you can sign up. We are always accepting sign-ons to participate. Yes, please feel free to keep putting questions in the chat. We'll then circulate the webinar recording as well as all of the materials that Lauren mentioned. So if you have another burning question that you send us just after, we can incorporate that in as well.
Stephanie, do you have a question in addition to the one in the chat, or is your hand raised about the sign up?
Yeah, it was clarifying. So last year, our organization accepted the challenge, but that was last year's challenge. Do organizations sign up each year to like agree to do the challenge, or is one sign up enough? And that, carries over year after year.
I see. Yes, good question. If since you're a member, you stay a member and you do not need to re-sign up every year. Taking the challenge, we really see as a call to action, and there will be a social media campaign around that. So we would really encourage you, and I'm happy to do it on your behalf too. If you write me a note on the side, just to get you in our system that you are taking the challenge. And then when you do activities that are aligned with the 2026 challenge around RANds, we are really looking to promote and help you get the word out. So that's the idea.
Any questions that we receive in the chat in these last moments, we'll include an FAQ and make sure that we follow up with responses. You can also email us or reach out at any time, and we're always here to provide support and answer those questions, and we'll keep the FAQ updated as well. I just want to leave this up on the side for everybody as you exit, a reminder of how you can reach us, how you can reach the coalition. Go to the website, learn more about all of the amazing work that they've been doing. Check out the 2025 Catalyst awardees and get a sense for really what we're looking for and how they have participated and contributed to the challenge. The office hours are there, no registration required. That link will be on the coalition website, and you can join those office hours at any time, Wednesdays and Fridays. The coalition has LinkedIn, YouTube, and Instagram accounts. If you're on any of those platforms, that's a great way to keep up with their news and make sure that you're connecting with everything coalition related as well. So thanks everyone for joining us today. I honestly just look forward to learning more about your work and the impact that all of you are having nationwide to help patients, to help communities, and to help advance RAN.
Thanks so much, Lauren. Thanks everyone for joining us.